hard to come by for some adults, and sometimes we need a little extra help. Sleep aids such as melatonin or something prescribed are gaining popularity. A new survey by the American Academy of Sleep and Medicine suggests nearly 2/3 of Americans take sleep aids. With us now is Dr. Cecilia Tran with Toro Family Medicine to tell us about the risks and efficacy of sleep aids. Hi, Dr. Tran. Good morning.
Good morning.
So I was surprised to hear that 2/3 of Americans take sleep aids on a pretty regular basis to help them sleep. What are some of the most common ones?
So the most common ones that people take over the counter is going to be melatonin, Benadryl, Unisom. That's the most common ones.
And I mean, are you saying that people are taking these like nightly, or is this just a once in a while type situation? What are you seeing?
So a lot of people seem to need to take it nightly. We do try to recommend them to really just do it for a short term, really not trying to do it every day. But when we're trying to regulate our sleep cycle, or if it's been 2 days where we haven't had really good restful sleep, it can be beneficial to try to take a sleep aid that night so that we could have a really nice restful night.
I mean, it can't be healthy to take something like Benadryl every night, right?
Not necessarily, because there are side effects. Every medication that we take has side effects, and it can cause you to have some dry mouth, urinary retention, especially if you have other medical problems or other medications that you take. The occasional Benadryl can be helpful, but not something that you would want to do every day.
Do you find that people build up a tolerance to some of these medications, that they just don't work if you're using them, continuously over time?
Yes, we definitely see that, and which is why we don't really recommend it for long-term use. Patients will develop that tolerance to where a medicine that may have helped them in the beginning will stop to and not help as much later on because they've been using it for so long.
So what would you suggest to somebody who, is watching this morning and says, look, I have all kinds of trouble falling asleep. I've tried melatonin, I've tried Benadryl, I've tried all these different things. It's just not working. What's the next step?
One of the biggest steps is actually making sure you practice really good sleep hygiene. That's reducing your screen time probably 30 minutes before sleeping, making sure you're in a cool, dark sleep environment, decreasing your caffeine use, and staying really active during the day. After that, really scheduling an appointment with your doctor to see if there's any other types of sleep aids that we can prescribe to kind of help regulate in the short time.
You mentioned melatonin. That's, I know, kind of considered the most natural sleep aid, if you will. In the pill form, is that something that's okay to take on, a fairly regular basis, or is that also something you would suggest kind of limiting your use of?
So melatonin is one of the more safer ones, but even with everything that we do, we want to make sure that we limit the use and not depend on something for a long term.
I've even heard of people giving their kids melatonin gummies. What do you think of that?
We have smaller doses for children that can be safe in the pediatric population. But once again, trying to really work on the sleep hygiene is going to be the number one thing that we would like to work on.
So you won't need one of those sleep aids.
Right.
All right, Dr. Tran, thank you again. We appreciate it.
Thank you.